diagnosis of malaria is very crucial and critical. It helps in identifying and diagnosing malaria. It prevents morbidity and mortality in patients. Not only it benefits patient but also benefits society at large because it stops the overall life cycle and the transmission cycles for malarial parasite. There are different laboratory methods for diagnosing malaria. The conventional method always has been peripheral smear microscopy using thin and thick smears, and this definitely is a good methodology for identifying and picking up malaria. However, the limitation being low parasitic index, where there is a chance that we might miss out on identifying a malarial parasite. This has been improved by some more improvements in terms of using an immunofluorescence stain or a quantitative buffy coat analysis. But still, low parasite index always remains challenging with this methodology. To address the low parasitic index, there were newer methodologies which came up, and these were like a rapid malaria antigen detection and malaria PCR. Talking about malaria antigen detection, this also evolved over a period of time where it was initially targeting Plasmodia species-specific LDH enzyme, and later on it was further coupled with one more biomarker which was histidine-rich protein 2. So most of the rapid malaria antigen kits which we have today is a combination of these two, where the LDH is useful as a species-specific enzyme, and this is coupled, or as an adjuvant is the HRP2, which is a specific biomarker which is released by RBCs which are infected by falciparum parasite. So it's a specific marker for Plasmodium falciparum, and identifying Plasmodium falciparum is of prime importance because of the treatment methodology which is recommended is different than that of Vivax. The malaria PCR, though it is still not a very cost-effective methodology, but definitely is something which will be useful in settings where we have a very low parasitic index. Modern hematology analyzers have got its AI inbuilt with it, and through this they do have something called as malaria flags. Now many analyzers have their own methodology in giving malaria flag by either identifying through the scatter plot or through identifying the hemozoin pigment present in the atypical lymphocytes or the monocytes. But in either which ways, having this kind of a flag given by the hematology analyzers prompts the users, especially when you have high volumes and resource limitation, it really is a great value add. This will further have a reflex testing of smear microscopy or a rapid malarial antigen test, helping the labs to pick up and diagnose malaria easily and at a faster turnaround time, thereby improving patient outcomes.